Okay students, now we're going to do the muscles of the hind limb of the cat. We're going to start off on the medial surface and work our way to the lateral surface. So the first two muscles that we're going to cover are the gracilis and the sartorius. They can be seen superficially, and you'll notice here's your sartorius, here's your gracilis. So there's not much that needs to be done except for removing some of the connective tissue and fat that may come with your cat before you identify those two muscles. So we're going to go over the origin and insertion of both of them. The gracilis, starting off, the origin is the pubic symphysis and ischium. Again, remember when we're talking about the pelvic region, the pubic symphysis will be right in the middle, going all the way down to the ischium. Now, the insertion will be the proximal end of the tibia. So you see that this is a wide band of muscle that comes all the way out from the middle or midline of the pubis, going all the way over to the tibia. Remember, your tibia is lower part of the hind limb. Femur is going to be upper part of the hind limb. Okay, now we have the sartorius. The sartorius is going to originate at the crest of the ilium, and it's going to insert on the fascia of the knee and proximal end of the tibia. So again, here we have it up here, all right, with the ilium, the crest of the ilium, back around here, and inserting all the way over here on the fascia of the knee and of the tibia. So you see this entire muscle. Okay, I'm going to go ahead and stick a green pin in the gracilis. Actually, I'm going to go ahead and move that pin over here. Green pin in the gracilis. Orange pin in the sartorius before I point out the adductor femoris. Now, coming just up from the gracilis, you'll notice that there's going to be a series of much smaller muscles that are visible. Okay. Not asking you to identify the rest of these, but there is this particular muscle, which is the adductor femoris. Remember, adduct means to bring something in, so it's bringing in the leg, and its origin is the pubis, and its insertion is the proximal end of the femur. So it's going to extend quite a bit, but we're just not going to see where it extends. Okay, now, as I peg that muscle with a blue pin on that side. Now we're going to go to muscles that are a little bit deeper, the semimembranosus and the semitendinosus. Those two muscles can also be found on the medial aspect in a more caudal position, or they can be located again in a caudal position on the lateral aspect. But first we're going to go through the gracilis and try and locate them medially. Okay, as I loosen the border away from the gracilis, again, this muscle is not that thick, so I'm trying not to cut anything else. Just loosen the gracilis and get underneath it so I can lift that body up off of the underlying muscles. And see, I can go all the way to the caudal aspect. Now, again, I'm going to bisect the body of the gracilis and reflect both the origin and the insertion. And removing some of the connective tissue with my with my gloved hand, we should be able to locate the semimembranosus and semitendinosus. So you see some borders of some muscles. You can take your blunt probe and try and find the outline of some of these muscles. You'll notice that this is the adductor femoris again, that was lying just underneath the gracilis. And then we come on to the area where we have the semimembranosus, which is this muscle right here. Now I'm going to try and clear the caudal border of it. Okay, so this is our semimembranosus, and right here will be our semitendinosus. There's often a good bit of fat. It's going to be at the caudal aspect of the semitendinosus, but it is this body of muscle right here. So the origin of the semimembranosus is the ischial tuberosity, and the insertion is the medial epicondyle of the femur. So again, you can see that this muscle is coming from the ischial tuberosity as its origin, going towards the medial condyle of the femur. The tendinosus, on the other hand, has its origin again on the ischial tuberosity, but its insertion is going to be on the crest of the tibia. Remember, the tibia is going to be in the lower half of the leg. So again, ischial tuberosity to the tibia. I'll go ahead and put a yellow pin in the semimembranosus and a purple pin in the semitendinosus. Now we're going to have to move for the last two muscles in this sequence to the lateral aspect of the leg. So moving the cat, again, instead of dorsal recumbency, moving it to lateral recumbency. We're going to be looking for the tensor fascia lata and the biceps femoris. Again, I've gone ahead and I've cleared some of the fat and fascia that were already on the lateral surface of the leg to make this video go a little bit smoother for you. So, number one, the biceps femoris. You should be able to identify the biceps femoris that has its origin not going to worry about that origin. Not here right now, but you should recognize it as this massive muscle right here on the lateral aspect. I will pin this with a white pin on the lateral surface. As far as the tensor fascia lata, one thing you need to make very certain, students, is that you do not cut away this fascia that's right here. This muscle is a muscle we already identified. It's the sartorius. See how far it comes back? Right under the sartorius and before the biceps femoris, you're going to have a very thick white fascia. Do not cut that away. That is the fascia that's going to be associated with the tensor fascia lata. I will use a yellow pin on the lateral surface. Remember, we already have a yellow pin on the medial surface, but I'm using this lateral pin, or this yellow pin on the lateral surface, to designate the tensor fascia lata. Now, the tensor fascia lata is going to originate on the ilium, and the insertion is going to be the fascia of the thigh. Okay, so tensor fasciolata, we revisit the biceps femoris, whose origin is the ischial tuberosity, all the way to the patella of the tibia. Okay, that's lateral. Again, we'll open the cat to the medial surface, putting it back in dorsal recumbency. And remember, we have the semimembranosus, we have the semitendinosus, we have the gracilis, the sartorius, and again, the adductor femoris, which was located also underneath the gracilis over here. Okay. That is the end of the hind limb of the cat.